Welcome, listeners. This is Ivan Franklin Rose, and this is the one on the health benefits of sex. This episode is not for children, and we will be discussing scientific and technical things that will help everyone in this regard. But just know that don't put it on speaker if you're with children in the room. All right, so the first thing we want to talk about is that sex can boost your mood, improve self-esteem, and enhance your relationship quality. But can it actually impact your health? Research suggests that having sex can lead to a number of potential health benefits, from improved mental health and sleep quality to a lower risk of heart disease and chronic pain. Keep listening for evidence on how sex can improve your physical, mental, and emotional well-being. In an article in Health.com by Laura Dorwart, a New York Times published mental health journalist, medically reviewed by Soma Mandal, a board-certified internal medicine physician with a specialty in women's health, says that there are 12 benefits, in her mind, to sex. We'll go through some of them here. First is stronger immune system. There's some evidence that sexual activity and orgasms may help your body mount a stronger immune response. This may help you fight off infection or inflammation more easily. For example, a 2021 study found that people who had sex more than 3 times per month were less likely to contract a serious case of COVID-19 than participants who had sex less often. This may be because sex has been linked to increased concentrations of leukocytes, white blood cells, and immunoglobulin, which is antibodies, both of which help the body stave off disease. That's fantastic news, I'm sure, for a lot of you out there. Next is lower blood pressure. While the act of sex can temporarily increase your heart rate and blood pressure, we know that, it may lead to a lower risk of hypertension, high blood pressure. In the long run, researchers believe this may happen because sex boosts endorphins, mood-boosting hormones that relieve pain and stress. One study found that women in long-term sexually satisfying relationships had a significantly lower risk of uncontrolled hypertension, which suggests that the quality of sex plays a role. And we'll talk about quality of sex later. After I do this, I'm going to be covering the 10 types of female orgasms. So please stay tuned, or if you don't want to hear this part, make sure you skip ahead a little later because you're not going to want to miss that. The next is improved cardiovascular health. Sex is associated with a number of positive effects on cardiovascular health, including a lower risk of heart attack, heart disease, and stroke, as well as related conditions like type 2 diabetes. It's not entirely clear why having sex can improve heart health. Some researchers believe that the consistent release of feel-good hormones, like endorphins and oxytocin, play a role. Others argue that intercourse serves as a form of exercise, which promotes oxygen flow throughout the body and helps to regulate blood sugar levels. So if you can be healthy and have fun doing it, why not? Reduced anxiety. Having sex on a regular basis may also work to prevent the onset of anxiety disorders and manage existing anxiety symptoms. Research indicates that sexual frequency, orgasms, sexual functioning, and sexual satisfaction are all linked to a lower risk of mood and anxiety disorders, as well as self-reported levels of anxiety. This is likely due to a combination of physical factors, such as the natural boost in testosterone that goes along with sexual intercourse, and emotional factors, such as a higher relationship quality and the stress-relieving impact of a supportive partner. Then better sleep. Sex and sleep have a dyadic relationship, meaning that the higher quality sleep can improve sexual functioning and vice versa. In a 2023 study recently, both men and women reported that partnered sex and masturbation with orgasm improved their sleep quality. I mentioned in my talk about sleep how one of the things is having an orgasm before you go to bed to easily fall asleep. And I had some people call me and laughed and said, hey, you don't know how true that is. Well, here it's mentioned again by a doctor. So in this study. So in this study, orgasmic sexual activity also lowered the risk of sleep latency, taking a long time to fall asleep. Sex may decrease the risk of insomnia because it lowers body levels of cortisol, also known as the stress hormone. It also prompts the release of prolactin, a hormone associated with both lactation and circadian rhythms. Reduce signs of depression is next. Just as it can lower your chance of developing anxiety, sex has been linked to a significantly reduced risk of depression. In particular, women who have satisfying sex on a consistent basis are less likely to report depressive symptoms, possibly due to the meditating role of hormones like testosterone and oxytocin that are released during and after sex. Fewer menstrual cramps. Women who have sex just before or during their period may experience some instant natural menstrual cramp relief. Orgasms release endorphins and contract the muscles of your pelvic floor, both of which can help to ease the pain of period cramps. It's amazing. Stronger pelvic muscles. Repeatedly contracting and relaxing your pelvic muscles during sex works to strengthen your pelvic floor. Stronger pelvic muscles are linked to a number of health benefits for women, such as improved bladder control and the prevention of pelvic floor prolapse. In turn, strengthening your pelvic floor can improve your sexual satisfaction and functioning, as it's associated with more orgasms, greater arousal, and less pain during intercourse. Then, headache relief. An opioid-like endorphins released during sex can relieve many different kinds of pain. In particular, sex has been found to relieve migraines and cluster headaches. One observational study found that 60% of participants with chronic migraines reported finding relief after sexual activity. Wow. It's amazing how good sex is for you. Lower risk of prostate cancer. I had prostate cancer, and I survived. So I know how important this can be to that. Researchers aren't sure why, but having sex, specifically orgasms, on a frequent basis may lower your risk of prostate cancer. A 2016 study found that men who ejaculated over 21 times per month had lower levels of prostate-specific antigen, PSA, than men who ejaculated less often. Lower levels of PSA are associated with a decreased long-term risk of developing prostate cancer. It should be 4 on the scale. The PSA should be 4 or less. If it's over 4, you want to get checked for sure. I try to cure mine with healthy foods and raw diet and anything I could, but it's still increased to over 5. So, and then I just had to have surgery. But I'm saying you want to watch your PSA counts, or just have a lot of sex and hope that it alleviates it for you. Prevention of vaginal atrophy. Vaginal atrophy, also known as vulvovaginal atrophy, VVA, is a condition that affects many women after they go through menopause. Due to thinning of the vaginal walls, it causes symptoms like vaginal dryness, burning, itching, and pain during sex. Sexual arousal and intercourse increases vaginal lubrication and blood flow to the vagina, both of which can help to relieve symptoms of vaginal atrophy. Reduce chronic pain is next. The endorphins released during sex act as natural analgesics, meaning they provide pain relief. Endorphins are released both during orgasms and when you're sexually aroused. Sexual activity may help to relieve some symptoms of chronic pain-related conditions, including arthritis and fibromyalgia. That's interesting. Let's do a quick review. Research about the effects of sex on your health as well-being is still ongoing. Still, there's plenty of evidence to suggest that sex can have a positive impact on your mental and physical health in many ways. Some of the health benefits of sex include a stronger immune system, lower blood pressure, better sleep, fewer menstrual cramps, migraine and chronic pain relief, and a decreased risk of conditions like heart disease, prostate cancer, pelvic floor disorders, vaginal atrophy, depression, and anxiety. So now we want to turn to another point of view, an article here in the Very Well Mind, March 21st, 23, so still recent, by Sherry Streitoff. She's written marriage and relation books for 20 years and is the co-author of the book, the Everything Great Marriage Book. Everything Great Marriage Book. And it also is medically reviewed, this article, by Carly Snyder, psychiatrist and internal medicine doctor that deals and specializes in women's care. And Sherry says, In a supportive relationship, there are many benefits to having more sex. Just how important is sex in a relationship? Higher rates of sexual activity are linked to positive changes, such as lower blood pressure, reduced stress, greater intimacy, and even a lower divorce rate. And that's fascinating. While there are no one-size-fits-all rules when it comes to an ideal sex frequency, we share insight from the latest research. This article also discusses how important sex is in a relationship, why it can be important to have sex, some of the benefits it may have, and statistics on how often couples typically have sex. It even covers challenges you might face as a sexual couple and what you can do if you want to increase the amount of sex in your relationship. So listen up. Why sex is important in relationships. Can a relationship survive without sex? Yes, sex isn't always necessary, but it can be an important part of a healthy, fulfilling relationship. How important sex is can vary from one individual to the next. Some people may feel that being a sexual couple is absolutely vital. Others may feel that other types of intimacy and connection are more important. Some of the reasons that you might feel that sex is important in a relationship include feeling closer to your partner, showing affection to your partner, finding sex fun and pleasurable, a desire to have children, feeling confident and sexy, and relieving stress. Research suggests that having frequent sex can play a role in a person's overall well-being. Having sex often is linked to more affection. When couples experience more affection, they are also more likely to then have more frequent sex. Recap. Sex can be an important part of a relationship, but having sex less frequency does not necessarily mean that your relationship is less satisfying. Just want you to know that. Let's look at the benefits of sex in relationships. So beyond individual beliefs and individual benefits for you and your partner, regular sex supports a healthy relationship in a number of ways. For instance, the oxytocin released during sex enhances a sense of bonding and improves emotional intimacy. Sex in a monogamous relationship increases your level of commitment and emotional connection with the other person. Expressing love through sex increases the likelihood of couples staying together. As a result, sex is positively associated with a lower divorce rate. Let's look at the psychological benefits of sex. There are many emotional and psychological benefits of making love. Sex is strongly linked to a better quality of life, and some of these benefits include better self-image. Sex can boost self-esteem and reduce feelings of insecurity, leading to more positive perceptions of ourselves. Higher rates of happiness. According to a 2015 study conducted in China, more consensual sex and better quality sex increases happiness. More bonding. Brain chemicals are released during sex, including endorphins, which decrease irritability and feelings of depression. Another hormone, oxytocin, the hug drug, increases with nipple stimulation and other sexual activity. We'll get into, when I go into types of women's orgasm, you'll see how that's one of the areas they cover. Oxytocin helps foster a sense of calmness and contentment. Stress relief. Chronic stress may contribute to lower sex frequency. However, sex can be an effective stress management technique. Sex reduces stress response hormones like cortisol and adrenaline, epinephrine, which affects lasting well into the next day. The effects last well into the next day. Improves sleep quality. Orgasms trigger the release of hormone prolactin, which aids sleep, what we discussed before. Physical benefits of increased sex. It is fairly intuitive to understand how sex improves emotional health, but there are a number of physical benefits from sex as well. Some of these include better physical fitness. Sex is a form of exercise. According to the American Heart Association, sexual activity is equivalent to moderate physical activities like brisk walking or climbing 2 flights of stairs. The motion of sex can tighten and tone abdominal and pelvic muscles. For women, improved muscle tone improves bladder control. We discussed before. Enhanced brain function. This is interesting. Preliminary studies on rats found that more frequent intercourse was correlated with better cognitive function and the growth of new brain cells. Similar benefits have been since observed in human studies. A 2018 study of over 6,000 adults linked frequent sex with better memory performance in adults ages 50 and older. That's phenomenal. Improved immune function. Being more sexually active have positive effects on immune function. Regular sex may even lower your likelihood of getting a cold or the flu. What a way to prevent it. Lower pain levels. The endorphins from sex promote more than just a sense of well-being and calm. Sex endorphins also appear to reduce migraine and back pain. Weight loss. Having sex for 30 minutes burns an average of 200 calories. The rewarding brain chemicals released during sex can subdue food cravings and support weight loss. Positive cardiac effects. Penile vaginal sexual activity, but not masturbation, has been linked with lower systolic blood pressure. Elevated blood pressure increases the risk of heart disease and stroke. Sexual activity helps dilate blood vessels, increasing the delivery of oxygen and nutrients throughout the body while reducing blood pressure. I never thought of it that way. Additional physical effects. Being more sexually active boosts libido and increases vaginal lubrication. Frequent intercourse is associated with lighter menstrual periods and less painful period cramps. In addition, an improved sense of smell, healthier teeth, better digestion, and glowing skin may be related to the release of the hormone DHEA by the body after orgasms. Sex can have a variety of benefits that can help support healthy relationships and may improve overall well-being. It is also linked to individual benefits, including stress relief, improved sleep, increased immunity, and better cardiac health. The ideal frequency for sex. When considering how often a couple should have sex, a 2015 study found that general well-being is associated with sexual frequency, but only to an extent. Relationship satisfaction improved progressively from having no sex up to having sex once a week, but did not improve further after that point. So even once a week is fine. One sexual encounter per week is fairly consistent with the current average. However, our increasingly busy lives may be getting in the way of having more sex. Compared to the frequency of sex in the 1990s, adults in 2010 were having sex 9 fewer times per year. So the average sexual frequency for an adult, 54 times a year, about once a week. If you're in your 20s, about 80 times a year. And adults in their 60s, about 20 times a year, unless you're unusual. Although frequency often decreases with age, sexual activity in older adults remains important. In general, older married couples tend to have sex more often than unmarried peers within the same age group. Potential risks of having more sex. It is once believed that sex increases the risk of prostate cancer. However, a 2016 study discovered that men who had more ejaculations, 21 or more per month, this is the study we talked about before, were less likely to develop the disease than men who had fewer ejaculations, 7 or less per month. And since prostate cancer is the second leading cause of cancer-related deaths in men, the effect is worth noting. Now, let's go to understanding that bursts of activities can put added strain on the heart. So we understand that. So discuss your sexual activity with your doctor to evaluate your risks. Also, unsafe sex could tip the scale of benefits and risks in the opposite direction, so make sure you're familiar with safe sex practices. The challenges of regular sex. While sex can be important in a relationship, there are a variety of factors that can make being a sexual couple more challenging. Age, hormones, children, stress, and medical conditions, and also relationship difficulties can all play a role in how frequently couples engage in sex. Age often plays a role in sex frequency, largely due to declines in sex hormone levels as people get older. Sometimes maintaining an active sex life is difficult or impossible due to physical or psychological conditions. Humans are wired to crave the intimacy of sex. Lacking sex can lead individuals in a relationship to grow distant and perhaps look elsewhere. Working with a licensed couples therapist can help address this gap and prevent issues from permeating throughout your marriage. Ways of building intimacy outside of sex. Couples can maintain a strong, healthy relationship despite these barriers by looking at non-sexual ways to improve intimacy. Ideas to consider include cuddling while watching a movie or sitting in the park, doing activities together that you both enjoy, such as dancing, giving frequent hugs and kisses, holding hands when you're walking together, and spending time talking to each other. Talking to each other is so important. Maintaining some topic of conversation. Now we're going to talk about something that is I hope not controversial, but it's important to understand if you're going to be pleasing your partner. We're just going to do the clinical, analytical, scientific description of what are the 10 different types of female orgasms. That's all we're going to discuss today. And then we're going to leave you that way without giving any tips. And we're not talking about how to do it better. We're just giving the facts. That's all we're doing here, is letting people know what the 10 different types are, according to different people. So an Health.com article by Kristen Canning in October 19th of this year, just a month ago. Kristen is a writer at Women's Health, Self Magazine, and Men's Health. And this is medically reviewed by Renata White, who's an obstetrician gynecologist in Atlanta, Georgia. So this is all clinical and backed up. This is what they say are the 10 different female orgasms. I hope you enjoy this. All right. They start with saying, an orgasm is a physical reflex that occurs when the pelvic floor muscles tighten and relax in a series of rhythmic contractions. Besides providing a physical release, orgasms also have emotional effects. During an orgasm, aka climax, your body also releases feel-good chemicals like oxytocin. The oxytocin released during an orgasm and the skin-to-skin contact during sex also helps you emotionally bond with your partner. But people with a vagina can experience different types of orgasms that feel different in terms of intensity and duration. We will discuss the different types here. First is clitoral orgasm, which everyone knows about. The clitoris is a sex organ that looks like a small erect tissue on the exterior of the vulva, but it also extends internally into your vagina. It is made up of millions of nerve endings which make it particularly sensitive to stimulation. Stimulating the clitoris directly or touching the labia surrounding the clitoris prompts an increase in blood flow to the area, making the clitoris engorged and in need of orgasmic release. The G-spot orgasm is next. Though research is a bit inconclusive, the general consensus about the G-spot is that it is located in the front wall of your vagina, about halfway between your vaginal opening and cervix. Some researchers argue it's a sex organ, while others believe it's part of the clitoris network of nerve endings. Some people reported G-spot orgasm feels deeply intense compared to other types of orgasms, which is fascinating. Vaginal orgasm. An orgasm from penetrative vaginal sex that doesn't intentionally stimulate the clitoris and G-spot is considered a vaginal orgasm. Besides the clitoris, the vagina has additional erogenous zones. The A-spot, or anterior fornix, is located on the high front, or anterior wall, of the vagina just beneath the cervix. This area can trigger a deep vaginal orgasm when touching the right way. Some people may also orgasm from touching the cervix itself. This is because these areas contain ligaments with nerves that can be highly sensitive. Anal orgasm is next. Anal sex or anal play can also help people with a vagina reach climax by indirectly stimulating nearby erogenous regions. This is because the anus and rectum are so close to the vagina and clitoris and are connected by a thin stretch of tissue called the perineum. Plus, your anus is connected to your pelvic floor muscles, which also supports your vagina. During anal sex, you can stimulate the same nerves and muscles, and because the pelvic floor muscles are highly sensitive, stimulating them during anal can lead to an orgasm. But please keep in mind, if your partner is willing to go, if both of you are willing to do this, you must be lubricated and you must be patient and take time in preparing the anus for anal sex. You don't just ram something in there. So please be gentle and kind with your partner and take the proper lubrication and proper steps to prepare. It can be very pleasant if both people are willing and take the time to enjoy it. Next is something that I had not really heard of before, but it makes sense, is nipple orgasm. Your breast and nipples are major erogenous zones, so it's possible to have an orgasm by stimulating those areas. The nipples especially react to touch since they contain many nerve endings. There's no clear consensus on how many women can orgasm without contact with their genitals, but researchers also aren't exactly sure why nipple orgasms happen. However, Researchers found nipple stimulation activates the part of your brain that controls genital stimulation. That's fascinating. Then there's a blended orgasm, which is a climax that happens when more than one erogenous zone is being stimulated at the same time. Any combination of erogenous zones, like the clitoris, G-spot, nipples, or anus, could lead to a blended orgasm. And of course, multiple orgasms. Unlike people with penises, people with a vagina can experience multiple orgasms because they don't require as much downtime between an orgasm and arousal. Remember, this is the clinical study doctors talking. This is not my take on it. This is what they're saying. This is how they describe it. So a squirting orgasm is next. During an orgasm, some people can release a gush of clear fluid, also known as squirting. Squirting is also sometimes called female ejaculation, but some researchers don't consider it the same thing. Researchers estimate that anywhere from 10 to 54% of women have, at one time or another, experienced female ejaculation. This is more of a liquid. It looks almost like pee, but it's not. It comes out very fluent, it looks like a clear liquid, but it shoots out there. It's fascinating if you have a partner that does that. And be prepared to have some towels and things handy because your bed will get awful wet with that. Exercise orgasm or corgasm. This is also one that I guess from riding a horse I've heard people have it. So here's how they describe it. In this case, reaching climax during an intense workout may sound unlikely, but workout-induced orgasms or corgasms are real. A study from Indiana University found that 370 of 530 women surveyed had experienced orgasm or sexual pleasure while working out, usually from core-based exercises. Who knew? And sleep orgasm. Similar to the wet dreams people with penises may experience, I don't know why they don't just say men, but it is possible for folks with a vagina to orgasm during the sleep. Sleep orgasm or nocturnal orgasms likely start with an erotic dream. This can lead to increased blood flow to the genitals and lubrication, making your body orgasm while you sleep. In a 2012 study, found people who slept on their stomachs were more likely to have erotic dreams and sexual sensations. This may be because sleeping on your stomach can be more constricting and physically stimulating. Think bed sheets, pajamas, etc., pressing on your body. So still, the exact reasons folks have sleep orgasms aren't totally proven or understood. So those are the 10 different types of orgasms. What you have to remember is everything has to be worked out, you and your partner, talking things out, understanding your bodies, taking the time and patience to please your partner and have a healthy relationship. You can have a healthy relationship with less frequent sex, as we said before, but it certainly has a lot of benefits that we've shown you today. And I hope that you just explore and take to heart and take the information and do what you will with it. I just wanted to provide the information so you knew how health can be benefited by sex in so many ways, and your relationship, and fewer divorces. So, with that, I hope you wake up each day with a smile, and maybe an orgasm. Have a wonderful day. Until next time, goodbye.